Good afternoon, ladies and gentlemen. Welcome back to the WWDNYK Studios, Pittsburgh, Pennsylvania. This is Dr. James Lyons-Weiler coming to you on the show Unbreaking Science. Today, it's a little frustrating to watch other countries do what they're doing so well and so much better. I just had a fantastic conversation where data was shown to me that the disparity in terms of the number of deaths and even in the number of cases that are being reported from a lot of countries are doing so much better than the United States. The geographic distribution of case mortality, infected case fatality rate, and so on, deserves a really close scrutiny and needs an explanation. And so today, to help me kind of address this problem a bit, that I've invited my colleague, Dr. David Brownstein. Hey, David, how you doing?
I'm doing great, Jack. How about you?
Good, good. As a person with firsthand experience with much less mortality and serious COVID illness, as has been established in the scientific literature from your clinic, what's going on? Why do so many countries in the rest of the world not have? I just heard this morning that California has more deaths than five other countries with larger populations in California combined. I don't have the statistics to handle what that is, but what's going on? Why do we have to have such a high mortality burden in the United States? What's happening?
Well, I think we can trace some of this back to the start of COVID a year ago. That when it was, we were told a year ago to, lock ourselves down in our houses, wear a mask if you're outside, social distance, and wait for the vaccine. We weren't told about what else you can do. We weren't told about eating better, exercising, drinking water, anything. And we were told to just wait, hide yourself and wait for a vaccine. And those of us that tried to bring attention to perhaps there's other treatments out there, perhaps there's other ways out there, were silenced. And First Amendment rights were found not to exist with this illness. And look where we find ourselves with that graph you just showed. And when I've written about this from the beginning, and I've said it from the beginning, when this postmortem is written 5 to 10 years from now on this, it's going to be an ugly read. We spend the most money on healthcare than any country in the world, nearly 20% of our GNP. The next country that spends the most is around 12% of their GNP. Everyone else is 10% or less in the Western world. And what do we get for that? We get 500,000 dead from COVID. It's a disaster. I mean, any way you want to look at this, it's a disaster. And we followed the rules. We wear masks. We social distance. Many of us locked down. People started working in their homes, and the roads are much emptier than they were. And what did we get for it? I think the interaction with Rand Paul and Fauci yesterday was a frustration. Rand Paul, we're all feeling that. What do you keep dictating to us for? And what are the, you keep telling us to do these things, and where's the benefits from it? And when you show that graph, I don't know how we don't rise up against this stuff. It's just a disaster, any way you want to look at it.
Yeah, so take a look at China, ladies and gentlemen. You can debate the quality of the data. Look at Australia and so on. I mean, the people that are in contact with me from Australia, they say they had accurate testing from the beginning. They followed the rules. They locked down as well. There's a seasonality to it as well. But when we're talking about things like, the Henry Ford study that we've talked about, and Anthony Fauci shutting down the discussion on early treatment, he personally is responsible for the opinion adopted by medical doctors who won't do early treatment intervention. Dr. Fauci himself is personally responsible, and you, sir, are personally responsible for bringing out the good news that you can have a holistic approach to viruses. In this book, this is your book, David, as you know, you've got a ton of information here that is backed by experience. How long have you been treating respiratory illnesses, David?
So I've been doing this type of holistic work for about 28 years now. And the therapy I used for supporting the immune system during this COVID crisis is the same therapy we've been using for over 25 years. We have little tweaks over the years as we learn new things, but it's virtually the same therapy. And we're seeing as good results with this as we did with other viral illnesses. And our patients aren't getting hospitalized, aren't dying at anywhere near the rates of what's being reported out there. And, there are other therapies out there, and you're right, with Dr. Fauci and shutting down the discussion. And it's almost like I'm at a loss for words for it. And it's infuriating, and it's upsetting. And we have over 500,000 dead that I don't believe had to happen. And in the country that spends the most on healthcare, how do we shut down debate? How do we shut down therapies? How do we shut down treatment when they don't really give you another option? They just say, wait for the vaccine. Well, we've had the vaccine for 2 months. I can tell you this week in my office was a horrendous week. COVID is back. We're getting our phone calls like we were back in March and April of last year. We're doing our parking lot treatments like we did in March and April last year. It was a wicked week at work, a busy, busy week. And, I'm hoping, I'm just hoping it's a little blip with things, but this week brought back bad memories. And, it's...
But when you say bad memories, you're not talking about... There's a bad echo, sorry. You're not talking about dead bodies on a stretcher. What you're talking about is people that are afraid because they have COVID. They say, Dr. Brownstein, what should I do? Your protocol is drive up to my office. We do outpatient treating in the parking lot. And here's what I want to go with this. What should Anthony Fauci, MD, have said to the American public, in your opinion? Let's play the game. I'm Dr. Fauci for a day. Fauci for a day with David Brownstein, Dr. James Lyons-Weiler. Go back to the beginning. What does Fauci say to the American public about this virus and about treatment?
I think that from the beginning, look, this thing was serious. We saw what was happening in Italy and the bodies and the dead. And, everyone was scrambling, a little bit at the beginning. And it was rough. And it was rough for conventional doctors. We didn't know what, nobody knew what to do when they were hospitalized and, what the right treatment was and what the wrong treatment was. We learned. And, I'm not blaming any of that. I think what Dr. Fauci could have done was said, we need help. We need all hands on deck. We need everybody's ideas. We need an open discussion and an open debate. And we won't censor you. We won't take your rights away. We won't shut your website down. We won't take your license. We need to talk about this, and let's see what works and what doesn't work. And let's be nimble, and let's be American, and let's do what Americans do, and let our excellence succeed here. And we didn't do that. Not only did we not let our excellence succeed, we held the excellence under the water until it drowned. And now we're at 500,000+ deaths, and nothing has changed. They said wait for the vaccine. We waited for the vaccine. Well, I'm hoping and praying this vaccine works, and if we get enough for herd immunity.
But we've done this. We've done this where we hope that the vaccine's going to work. What I want to do is I want to hear from you. You're Dr. Fauci. You've got the microphone in front of you. Okay, it's May 2020. Given what you know as a medical expert, to your colleagues in public health, to your colleagues in medicine, what should America do?
All right.
Yeah.
Let me be Dr. Fauci starting in March when this thing started in the U.S.
Okay.
February and March.
Go for it.
We have a serious illness coming. There's deaths around the world. It's going to affect us. We don't have immunity to it, and it will turn into a worldwide pandemic, which is exactly what I said in February. And I had this discussion with you a few months ago, and what I would say as Dr. Fauci, what I'd say to Dr. Fauci is exactly what I told my staff the end of February of 2020, before COVID had hit. There were a few cases in California, a few cases in Seattle, and everybody knew it was going to come because we didn't do the things from the beginning. I mean, really, I guess if we want to look at the very beginning of this, Dr. Fauci, we should have strictly quarantined sick people. We should have checked everybody coming off a plane from any infected area. We should have followed, what's the word where they follow
contact tracing.
We should have contact traced all those people, just like they did in Taiwan and Korea. And we wouldn't be in the mess we're in right now. But we didn't do that. So we missed that boat. But once COVID started, what I would say as Dr. Fauci is, hey, perhaps we can overcome this with our immune system, since we were blessed by our creator to have an immune system, and it has been fighting viruses and bacteria and other illnesses for tens of thousands of years. And if we had strong enough immune systems, we can get over this. And that's the approach I took with my patients. I've been treating viral illnesses and flu-like illnesses for 28 years using a holistic approach of items just to support the immune system. I never said my therapies kill any virus. They certainly don't keep you from getting COVID. They don't keep you from getting influenza A or B or H1N1. But when you get exposed to those and you become infected with those things, your immune system should go into gear. Your adaptive and innate immune systems that work together to neutralize and overcome these illnesses. And then you have immunity for life. And that's how things go. And look, we know this, our immune system works. I mean, how did we all survive measles and chickenpox and all the other childhood illnesses? And guess what? When we had measles and chickenpox, we had lifelong immunity after we had it. The idea that basically hide out in your house and wait for this vaccine to come in January of 2021 clearly didn't pan out as well as we wanted it to. But if Dr. Fauci didn't know about items that could aid in this mess, he should have asked for it, and he should have called for all doctors around the country to start writing what works. What are you seeing works? What are you seeing don't work? Let's collate the data and then let's study it. And doctors are not stupid. Those of us in the front line, I didn't close my office during COVID. I stayed open. We treated them. We were doing parking lot IVs with our phones on for flashlights, at night on people. And, I could immediately tell you the first 2 weeks of COVID last March, what was working in our office. And what was working was an oral protocol of vitamins A, C, D, and iodine. Nebulizing hydrogen peroxide and iodine was just a fantastic therapy and continues to be that fantastic therapy today, just as it was 20 years ago when I was using it. And if people needed more therapy, they would come for IVs of vitamin C, hydrogen peroxide, and ozone shots. And, I would have reported it then. I'm happy to report it now. And, I did report it back then. But anyone who reported any success with, I'm not going to say treating COVID, but, any success with COVID patients was basically received a warning letter from the Federal Trade Communication telling them cease and desist, or you'll hear from the U.S. Justice Department, as I did. And so we shut down dissent, we shut down debate, we shut down scientific discussion. Dr. Fauci is a physician, and to shut down scientific discussion I don't have words for that. Since when have we ever done that? And because of that, we lost our American initiative. That we've overcome a lot of things in our country. I thought our country was better than this, and I don't understand how we let it happen, and how we let him and the establishment and the politics get in the way of treating people and supporting their immune systems and doing what's right for them. And, to show for it, 500,000 dead, trillions of dollars spent. We're not done with this thing yet, as it showed me this week in my office. And who knows where we're going to go from here. So I think it's beyond time to open up discussion and debate and freedoms to allow us to talk about what we should be doing with this.
Yeah, I agree. So everybody was using real world data. The COVID-19 death rates, all of the COVID-19 case rates, all of those reported and so on, that entire process using real world data in real time when we were learning. And one of the early things that happened was you realized that your mortality rates were divergent in your practice for people that you treated. And you realized after you had treated something like 107 patients, hey, wait a minute, hey, this is such a big difference. We need to bring it forward. One of the things that Fauci couldn't have known that we just are now learning is that 80% of the people who die from COVID or get serious COVID-19 walk into COVID-19 with autoantibodies already to something else. They already have an autoimmune disease, right? So it's not just that you're old. It's not just that you have comorbid conditions. This is a profound realization. I think about 8% of, there's a study out there that shows 8% of people that survive COVID-19, and it's mild. They have symptoms, but it's mild. They don't walk into COVID with autoantibodies. The autoantibodies track to the Th2 skew in the immune system. The Th2 skew in the immune system tracks to the aluminum that is prevalent in vaccines and so on. And so your protocol, which is peer reviewed and published, but also outlined, I think, this is a general discussion on how to enhance your immune system to fight viruses, to prepare your immune system, would undo the harm of everything in the environment causing Th2 skew. People don't understand Th1 versus Th2. Th1 is more of a viral-like reaction. Th2 is more of a bacterial focused reaction. And so your immune system is primed to attack cells as opposed to neutralize viruses. And we want a Th1, Th2 balance there. So there's a lot that Fauci could not have known. But the sticking point, the thing that really sticks with me, was how woefully irresponsible he was to misinterpret the Henry Ford study, for example, on hydroxychloroquine, and to say don't pay attention to it because we don't know if it was corticosteroids. The aims of the study were not corticosteroids versus hydroxychloroquine. It was corticosteroids plus some of them got the hydroxychloroquine, plus some of them got corticosteroids. Wow, he should have said, I think that Fauci should have held a press conference, said, this is fantastic, guys. Look at hydroxychloroquine use plus corticosteroids. There appears to be something there. Could you please replicate this study? And a study called for long-term randomized clinical trials. Everybody look at your hydroxychloroquine data, do it for 2 months, and let's see where we're at. That's what he should have said. I think it's woefully irresponsible. It can't believe that he is still out there giving advice and stating his opinion as a fact when he's been wrong on every single thing that he has said in the past. There's not a single thing that he has said except for, yeah, I think vitamin D is good. I take vitamin D, that I can track to him not having to change his opinion on. That's amazing to me that he's still in the place that he's at. It's just unacceptable.
Well, that Henry Ford study was very interesting. They found 50% less mortality in those treated with hydroxychloroquine. So after the study was done, Henry Ford asked the government for approval to continue the study and continue using hydroxychloroquine in COVID patients, and the government said no. They refused them future research money to do that.
It's about then, at that time, when the medical industry and the ethical physicians like yourself should tell the government to go to hell. Because there's, just like Peter Corey did, he went to the Senate and he said to the Senate, listen, I can't do this anymore. I can't watch body after body after body pile up and get shipped out of my clinic. We have to have ivermectin. We have to treat. And he pleaded with them and pleaded with them. You're right, David, in 5 years' time, but I don't think it's going to take 5 years. I predict within the next year, there's going to be such a backlash because these people that get the vaccines, in 8 months' time, they're going to be told that they have to get the vaccine again. Well, guess what? People that are getting the vaccine now are having such a hard time with the first dose, they're not getting the second dose, right? And I guarantee you're going to see people that find you in your clinic that say, I had the vaccine, but I got COVID anyway. Can you help me, right? You're going to see people where it's not breakthrough infection. The vaccine could actually predispose you to disease enhancement, as we know. The vaccine can actually make it worse. The vaccines, especially if they say, you know what, while you're here, we'll give you the flu shot as well. 60% of the flu shots contain thimerosal. Thimerosal inhibits ERAP1. ERAP1, you need to be able to fight off things like other respiratory viruses. This is all scientific peer-reviewed studies, and yet people are going to associate their increased sickness with, I got the vaccine and it didn't help me at all. And how many times for the decades before when people said, you know what, I don't usually get the flu shot, but I got the flu shot this year and I had the worst case of flu ever. How many times do we hear that? So I think that the American public is not going to put up with this anymore, but it just takes the people in medicine to stand up to the administrative codified practices and say, we don't care about that anymore. We're going to do what we got to do because people's lives matter.
You know, I took an oath in med school that said, you know, in part, above all, do no harm. And my oath was to my patients. When COVID was coming around, we were scared. The whole damn office was scared. I didn't know if I was going to get it and die. I've told you before, I've got severe asthma. I've got 65 degrees scoliotic curve with a lung involvement where I have less than half of one lung. My normal pulse ox is 94%, 95%, because I don't have any lung space, enough lung space to fully oxygenate. And I have an immune system deficit. I have a lack of vitamin A, IgA. So I'm prone for viral illnesses. I was as scared as anyone with this thing. But, I wasn't closing my office. I just, when I was in my training in the AIDS crisis, I saw AIDS patients. I know doctors refused to see them, refused to touch them, refused to evaluate them. But, the Dr. McCullough, has been talking about this. And, I think that physicians need to stand up. We need to stand up for our patients. We need to be able to use whatever therapies are out there for our patients, whether it's hydroxychloroquine, whether it's ivermectin, whether it's vitamin A or vitamin C or iodine or something like that. And let's report what works. Let's figure out together what works. Let's do what Americans are designed to do, come up with unique ideas in difficult situations.
As far as I can tell, David, you figured out what works. You have data from your practice now. You had 107, that was peer reviewed. Now you have more, and you're not saying that, wow, look, the mortality rate in my practice is going up. I don't hear this from you. You're not saying that things are getting worse that way. So I think you have figured it out. And I would encourage everyone to here's the mission statement today. Get this book, A Holistic Approach to Viruses by David Brownstein, and send this book to your doctor, the doctor that treats you. Your doctor needs to know what's in this book. If your doctor doesn't know what's in this book, how are they going to use that information if you get coronavirus, or if you get the flu, or if you get bacterial pneumonia? Or, the differential diagnosis problem is real. We're dealing with that with other things. But if you become sick with an infection that's respiratory, this book is for your doctor. So your best thing that you can do is educate your doctor. So I would absolutely, A Holistic Approaches to Viruses. If I get sick, I want my doctor to know what's in this book.
It's not only educate your doctor, you got to educate yourself, because unfortunately, physicians have zero training in holistic approaches, zero training in nutritional supplementation, virtually zero training in diet. I had to learn that on my own. You can see the books behind me, and, I've got stacks of books around my house and articles and things like that. And I'm still learning. My learning is going to stop by the time I take my last breath. But doctors are woefully not trained on how to support the body and how to optimize the immune system function. What we're trained is how to diagnose pathology and how to prescribe the one drug to treat that pathology. That's our 4 years of medical school. And in our residency, where it gets cemented in you that that's how you do it. And when I started doing that in real world time and real world medicine, I didn't like what I was doing. I was, after someone was talking to me for 30 seconds to a minute, I started writing out a prescription. And that prescription most of the time wasn't treating the underlying cause of their illness. But it was usually, I was writing out the script. I didn't really care whatever else they were saying. I was already done in my brain. I had made my diagnosis. And that prescription was working in the body by poisoning enzymes and blocking receptors. It wasn't supporting anything. Right. And I just didn't like that type of medicine, and that's not the way I wanted to go. And I, did a 180. And, it's stressful practicing holistic medicine because you get flack from the powers that be. But I wouldn't change a thing of what I did. It's made medicine fun. I wouldn't be doing it if it wasn't fun. And, I wouldn't say COVID was fun to treat, but it sure was exciting, and it sure was thrilling, and it sure was scary all at the same time. And, it took us about 2 weeks into it a year ago to figure out, hey, therapy's working just like it did the last 28 years. I think we're going to be okay with this. And, a week or two later, we were on our way. And, we're still doing it. We've treated over 250 patients now. I didn't even count the last 10 days or 2 weeks, which we've seen all these increased phone calls. And, I was out in the parking lot this morning, seeing a patient. So I have a feeling this weekend's going to be a busy weekend for me. And, it's a good thing because I feel like I'm helping them. But, there was more to just hide in your house, wear a mask when you're out, social distance, and wait for that vaccine. There's much more to this. And look, let's take the vaccine that it's going to work, and that let's say it's 94% effective. Those are relative risk numbers, not absolute risk numbers, which are much lower than that. But let's hope it's 94% effective. Let's hope it's 100% effective. How do you think that vaccine is going to work in someone with a poorly functioning immune system, who's Th2 skewed going into it, who's lacking basic vitamins and minerals, who doesn't have the basic raw materials the immune system needs to work to produce those antibodies and produce the memory cells to fight SARS-CoV-2 when it comes in contact with you? How do you think it's going to work? It's not going to work well. They're going to be more prone to side effects and more prone to serious side effects. So the therapy that I'm proposing should help people whether you're going to get the vaccine or you don't get the vaccine. And it's what we were designed to do. It's what physicians should be doing, I think. And it's a good way to practice medicine. And people can feel better and do better. And you're not just covering up things with drugs. I mean, if you think about what we told people with COVID, beginning of this thing, if you weren't doing a practice like mine, you probably closed your office, took a phone call from them. Wasn't hard to diagnose. It was flu-like illness. You got COVID. Well, stay home. What else can I do?
Yeah.
Go to the ER when you can't breathe.
That's not medicine.
Yeah.
That's not medicine.
That's it.
Your credit to your profession, Dr. Brownstein. So if you live in Michigan, check him out. He's not too far from, like an hour and a half away from Detroit?
40 minutes outside of Detroit.
40 minutes. Yeah. Check him out and get this book and read the peer-reviewed study. And, I'm going to say it, educate your doctor, because they're the ones that are stopgapping all of this. Read the book yourself. Get a copy for your friends and your loved ones, but get an extra copy for your doctor. They will appreciate it because this is so chock full of argued and backed up referenced evidence of the efficacy of every element of the therapy that Dr. Brownstein uses in his office on all respiratory illnesses, and it transferred over beautifully. The evidence shows, there's really strong clinical evidence that shows that your patients are doing just fine. So,
and Jack, it's one of the criticisms I got from the FTC was it wasn't a randomized controlled trial. I wasn't going to randomize people. How could I do that if I thought the therapy was going to help them? When we started doing the therapy, I didn't think about writing up a study. I was just trying to treat people and trying to get through this and trying to help people and do the right thing. And I decided to write that study after we saw the results come in, and there was nothing out there. The news was terrible. The headlines were terrible. Dr. Fauci's press reports were terrible. Everything was terrible. The hospital reports were miserable, and then the bodies and the trucks waiting for the excess bodies to pile them up, and it was awful. So I trying to shine a light in the wilderness, and once we get rid of this censorship and this silencing, I think we can move forward and get a hold of this. But until that occurs, I think we're going to keep swimming I call it swimming in the dark waters with, a gray fog around you. You don't know where you're going.
Absolutely. So, your case series studies is one of the most elegant uses of real world data that I've ever seen. In part, I'm biased because the results are so compelling. But in reality, it is as small as it is. It is a good piece of science for what it is. The randomized clinical trial that you would do would not be no treatment versus the therapy that you offer. It would be whatever treatment that they say. So it'd be something like remdesivir versus yours. But as an ethical physician, the rates of remdesivir are worse than yours. So how can you do it? And that poses a real ethical conundrum for anybody that says, how are we ever going to do randomized clinical trial on something that's truly highly efficacious out of the box? And we know the emergency use authorization doesn't require randomized clinical trials. What it requires is evidence that it might work. And so, there's a double standard for something that is highly, highly profitable, like the more expensive remdesivir, than other things that are cheap, like ivermectin and hydroxychloroquine, and certainly a vitamin regimen to make your immune system better able to tolerate viruses and fight them off. Well, David, I want to thank you for being on Unbreaking Science. I hope that we can look forward to more peer-reviewed work, from data from your practice at some point. I would certainly encourage that. And if anybody wants to get a hold of Dr. Brownstein, you know how to get a hold of me. If you want to interview him on your podcasts, there's some action ongoing in coronavirus in Michigan right now. And Dr. Brownstein is a frontline doctor taking care of business. Thank you, David.
Thanks for having me, Jack.
Right on.